The question is, what is the future of telehealth, which is just another word for telemedicine, but it's broader than telemedicine, in Arkansas? There's a lot of things that we need to do that we haven't done. But since we're talking primarily about dentistry, I'm going to relate it to the dental profession. One of the things that UAMS has done immediately after the study that we performed is to start an organization called the Center for Dental Education. That center is the first essential component at UAMS on the way to having a College of Dentistry and other programs. And other programs is continuing education for dentists. We don't have enough continuing education that is available, especially for dentists who are out in small towns. And the UAMS has one of the best networks for delivering programs over the telehealth network of any state in the nation. We are really a state leader. Years ago, I was involved in the beginning of that program when we set up programs with 3 rural hospitals in southeast Arkansas. That was the beginning of our telehealth network. It is now, with many people being involved, it's a huge network. And it will provide even more than we have ever done before for dentistry when we have a College of Dentistry here and a faculty that can address all of the issues that need to be addressed in dentistry.
Any other questions? Well, just to sort of follow up on that, where are dental schools surrounding us? And are there dental schools in all of our surrounding states that most Arkansans go to and then come back here and practice? Or what has been the pattern for developing dentists here?
Yes, there was a feeling back several years ago, it dates all the way back in the 1940s, that if we set up a system in Arkansas to have an agreement with our neighboring states, that they would provide the education for our dentists that we were not providing here. 8 schools do participate in that program. Tennessee is the one that delivers about 70 to 80% of the dentists in Arkansas. That sounds like a good system. The problem is that it has only delivered not more than half of the new dentists that we need every year. And when you start calculating the number of new dentists, you have to take into consideration the number that are retiring each year. And the number of dentists in this state that are over the age of 50 is more than half of the dentists in the state. 52% of our dentists are over the age of 50. And studies, both nationally and elsewhere, have shown that most dentists in their early 60s are not more than part-time providers of dental services. So we face, I'm going to give a long answer here, excuse me.
That's all good.
We face the probability, and in fact our study, here's what we did. We went back 10 years and said, how many new dentists every year come to Arkansas and get licensed? The answer is an average of 33. How many dentists retire every year in Arkansas? And the number in 10 years was something like 57 to 60 per year. Now, you don't have to know anything more than first grade math to figure out that if you have a system like that, over the next 10 years, you may lose 25% of the dental workforce. So that's just one of the findings that we made in our report. And it's one that's quite powerful, I think.